Thanks so much, Kerry. Well, firstly, I am a clinical nurse consultant up here on the Sunshine Coast. I specialise in safety, quality and health service redesign. And my clinical background is in the intensive care setting. And I have been nursing now for over 21 years, which is incredible. And 4 years ago, at the age of 38, I was diagnosed with bowel cancer. And at the time, I had an 18-month-old and a three-year-old. And I had recently come back to work after my second maternity leave. So that, of course, was an incredible shock. As a clinician, I think we think that we understand the patient journey very well, particularly, I guess, as I had been working in health in lots of different settings for so long. In saying that, the patient experience to me was quite a shock. So stepping in the shoes of a patient has been an incredible journey for me. And over the last 4 years, I have merged into the patient advocacy space. And I do a lot of work around raising awareness about young onset bowel cancer, as well as talking about the unmet needs of cancer patients as a whole. And I do focus on what well-being in cancer survivorship looks like, both for patients, but also for health professionals. And more recently, I have been involved in some research projects, which has been fantastic. So today I do some work with Bowel Cancer Australia as well. I have set up their National Survivorship Program, which is an online moderated forum called The Movement, which has been a fantastic, I guess, what would we call it? A platform that we've built for Australians with bowel cancer and their loved ones as well. So that's sort of where I find myself now. So I still do a mix of both, working in the clinical space and also in the advocacy space.
That sort of brings me, I think, is a really interesting to hear a little bit about how you got then involved with Cancer Voices Australia. You talked a little bit about setting up a platform for consumers to be involved in, but I know that Cancer Voices Australia also has a fantastic program which our researcher Nicola Gadd has access for her work around having consumer representatives who are trained, and also they're part of a network and supported by Cancer Voices. So if you're able to tell us just a little bit how you got involved and the sort of work that you're doing with Cancer Voices, that would be fantastic.
Sure. I really enjoyed my time in working with Cancer Voices Australia, and they are a fantastic platform and program for, firstly, for consumers to link into. So I often have consumers reach out to me and ask me how they can make change. They want to improve the patient experience after their own lived experience. They want to improve patient education. They want to improve equity and access to different services. They want to improve research. They want to see new research in their area, and they want to advocate for change. So I always talk to patients about joining a group like Cancer Voices Australia. Because it allows us access as consumers to a wide variety of different research and projects that are going on, and it allows us to have our voice heard, which is an incredible experience, and is very well managed and coordinated. And for researchers and clinicians, it is a fantastic platform because I guess the assessment of the consumer has been done. They have their history and experience already vetted, if you like. So you know the type of consumer who you have coming to you, and you make sure, I guess, at the outset that they're a good fit for your program. So the people who are involved in Cancer Voices Australia are very passionate, and they're there because they want to see change, and they want to help people who are either going through their own cancer experience now, or in the future are going to have their own cancer experience, and they want to make sure that the quality of life is improved for those people. So it is a really great network to tap into. And I guess, Kerry, I could add the type of work that I've been involved in to date. So I have worked on a number of different patient education resources. I've done some work with Nicola Gadd, who is a PhD student up there down there, I should say, at Tasmanian University, which was also a fantastic experience. And I'm about to wrap up a 12-month project where we've been looking at the National Colorectal Screening Guidelines for Australia. So that is a really exciting and important body of work that we're hoping to have published in the next month or so. So the work that I did with Nicola, basically anything that I see coming through Cancer Voices Australia that comes to me, which talks about improving timely diagnosis for bowel cancer patients, which talks about how we can improve patient outcomes, and which talks about improving quality of care. Those are all of the things that I look for as a consumer. And I also look for any projects where we talk about more broadly across the cancer space, improving patient outcomes. So Nicola's project definitely fitted that category. And in particular, I have a strong interest in looking at patient resources. And when I do that, I look through the eyes of the consumer and also through the eyes of the clinician. So making sure those two areas meet, and that we're conveying information really well, and also how a consumer would receive that information. I know myself that when I will write patient resources, sometimes it still does have that clinical lens over the top, overlaid. So taking a step back and looking at through the eyes of the consumer is really important. And Nicola's work, which does look at how we can improve timely diagnosis, which will impact treatment outcomes, is an incredible piece of work. So there was no question that I didn't want to be involved with her project.
What makes it easier or more possible for consumers and community members to be able to contribute? What are some of the things that might support that to happen?
I think, and that's a really great question. And I love that we're seeing the consumer partnership emerging, and it's a lot stronger, I would say, in the last 5 years than it has been previously, which is fantastic. But I guess engaging consumers early on, so in that design phase, is really important, and seeing the consumer as a partner rather than an optional addition or something that we need to do as part of a tick box process. And I say that with all due respect, but I do see that as a consumer in different areas and also as a clinician. So really thinking about how you co-design with a consumer is really important. Timely communication, being very clear on what you want from the consumer is so important. And like you would treat any member of the team. So I often say to clinicians and teams, treat your person with lived experience, your clinician, as someone that is as valuable as your other team members. We want to know why and what. So essentially, why is your research, why is your project so important? How is this going to improve the patient cohort that I represent? So how is this going to improve the health, the clinical outcomes, the patient journey? How is this going to help our patient population? And keeping in mind that the person with lived experience or the consumer can also be a carer or a loved one. It's not always the person involved. And that's quite important because we do get different perspectives from the person with lived experience and from the carer or the loved one as well. I guess those are the main sorts of things, making sure that your call to action is really clear. What do you want from us? How can we best support you? And tapping into the platform like we've talked about with Cancer Voices Australia because you know then you can ask for particular, I guess, qualities or experience in a consumer, and that's quite important. I'm really fortunate enough that through my online platform work that I am doing now and that I've done previously, I've been able to connect with a whole range of cancer patients from across the country. So I know the types of questions and the types of issues and gaps that those patients are experiencing and facing. So if you want a breadth of experience, do put that in your proposal request. Don't be afraid to ask, because people will have different ideas. And if you are looking at an intervention, of course, that involves an older age group, then you do want to have a consumer that has that experience. Equally, the younger patients, or mothers or fathers, just be very clear on what it is that you need.
Thank you, Sally. I think that's really terrific advice, is, in terms of involving early, making sure that the lived experience person is really a part of your team, just as a valued member of the research team, just like anyone else, and treated as such.